Good evening, everyone, and welcome back to our Stats with Sara report for CDC Week 32. My name is Sarah Wilton, epidemiologist at the Jefferson County Health Department. Together, we will be reviewing the COVID-19 data for CDC's Week 32, which is the week starting Sunday, August 2nd through Saturday, August 8th. We did have a total of 339 lab-confirmed and probable COVID-19 cases, bringing us to a total of 1,787 cases for Jefferson County as of week 32. Our total COVID-19 associated deaths are now at 28, which we discussed a little in last week's video. We did have an additional 3 fatalities that were reported to us last week. We currently sit at 13 outbreaks within our long-term care facilities, which is an increase from week 31. Last week, we experienced 28 cases within those long-term care facilities, which means that 311 of the 339 cases were in our community's general population. Today, I plan on focusing a little more on our school-age population, which is that 0 to 19-year age group. So after our main report, the countywide week 32 report that we're going to talk about today, we are going to switch things up a little bit and dial in on that younger school-age population instead of the report that excludes our long-term care facilities. We understand that this particular data is becoming highly requested as we near the start of school, and we definitely want to make sure that we are providing you all with as much information as we can. Let's look at Table 1 together of our community-wide Week 32 report. Here we see the number of lab-confirmed and probable COVID-19 cases by week. The date in the second column shows the CDC week start date. So our week 32 data includes everything that was reported to us between August 2nd and August 8th, which is the end of week 32. That third column shows the weekly case count, and that very last column is our cumulative total. I would like to briefly mention that all of this data that we review together is preliminary and may change as more reports are received. In Figure 1, we are able to visually see that trend of those weekly case counts. Jefferson County is still seeing increases as time progresses. We had a 12% increase in cases last week, which was less of a percent increase than the 2 weeks prior. Next, let's look at the daily case numbers and that 7-day rolling average of cases. That dotted line shows the number of daily new cases, and that solid blue line is that 7-day average. That 7-day average does help us account for any fluctuations in the data, such as when we have days where fewer cases are being reported or on days where many cases are being reported. As you can tell, it helps to give us a better overall visual of the direction that we are heading and helps to smooth out many of those high and low case spikes. Figure 4 shows the confirmed and probable cases according to age group. We continue to see a large amount of cases in our 20 to 29-year age group, and the highest rate per 10,000 is within that 80-plus age group. As I mentioned earlier, I'll be breaking down our school-age population into a little bit more detail in just a bit. Moving on to the fatalities and the fatality rate by age in Figure 5. Here we can see that the 3 deaths that were reported to us during week 32 were all in the 80-plus age group, bringing the total for that age group to 14. The total number of fatalities for our county is now 28. The approximate COVID-19 cumulative fatality rate for Jefferson County is now 1.57%. This is still below the rates for Missouri and the US, which are 2.22% and 3.24% respectively. Moving on to Figure 7, we are seeing the weekly PCR test results for Jefferson County. This data differs from the weekly case count, we always begin our videos with because it does not include the antibody tests or the probable cases. This figure is where you're going to find that percent positive in our community. When we calculate that percent positive, we take the total number of positive cases and divide that by the total number of diagnostic tests given for the community. So that dark blue dashed line is the percent positive. And in the next table, we will be able to see the actual values that are plotted on this graph here. Table 3 shows the positive and negative test numbers per week. And looking down at week 32, we can see that the number of lab confirmed PCR positive tests that were reported as of August 8th, which is the end of week 32, was 305. When we are looking at just those lab confirmed cases, the number in that third column from the left, we are still seeing an increase as we move from week to week. The percent positive can be found in that very last column on the right. Our percent positive for this past week was 15%. Our negative tests were a little lower than the average number of negative tests we have been receiving over the past few weeks. And as I stated last week, we do have a slight delay sometimes when receiving those negative test reports from the state. This is why you might see the negative test numbers and that percent positive change just slightly when we are looking back at some previous data. I keep all of our numbers as up to date as possible, but there are certain times when we receive information that has past dates. So I definitely want you all to be aware of that. In figure 8, we see the COVID-19 case rate by race per 10,000 residents. The Black population in our community currently has the highest rate per 10,000. However, our white population in the community has the highest number of cases with 1,420. We do not include any of the missing or unknown race data when we calculate these rates. Figure 9 shows our cumulative number of cases by zip code. We are continuing to see the same few areas with higher total numbers of cases. Arnold, Fenton, Festus, and Imperial are among these. The majority of zip codes had around a 25% or less increase in cases from week 31 to week 32, meaning that we didn't really see any one particular spot that had a significant increase in cases. It seemed to be somewhat evenly spread out last week. And when we look at the rate per 10,000 residents for cases separated out by zip code, you'll notice that the numbers look a little more balanced. When we use rates, it helps us to even things out a bit. And in this case, it helps us to make a fair comparison among those areas that have different populations. For our hospitalization data this week, instead of using the resident reported data as is in our previous weekly COVID-19 surveillance reports, we are going to take a look at the hospitalization data we receive directly from our local hospital systems. We are currently receiving data from BJC and Mercy facilities and are actively working on receiving that data from SSM. As of week 32, a total of 123 COVID-19 associated hospitalizations have been reported from the hospital systems for Jefferson County. 22 of these patients were admitted into the ICU and 7 positive COVID-19 cases required ventilators. In figure 1, we can see the hospital admissions and a 7-day average of hospital admissions. This tracks the admissions by the date that they were actually admitted into the hospital. And that solid blue line is the 7-day average, which again helps to smooth out those high and low spikes of days where there may have been more or less admissions. Next in figure 2, we see the hospitalizations by age group. The 50 to 59 and the 60 to 69 age groups show our largest number of hospitalizations at 22 each. But as you can see, according to the data that comes directly from the hospitals, we even have cases where our younger population is being hospitalized. This data is most likely going to look a little bit different than the resident reported data for a couple different reasons. Keep in mind, we are still missing a chunk of data from that SSM system. But also when we rely on that resident reported data, as we had in past reports, there may be times when information is omitted or simply unable to be obtained. And lastly, I think this particular graph is one that contains information that is highly requested among our community. Figure 3 shows the length of hospital stay for COVID-19 patients. Along the bottom there, you can see the various lengths of hospital stay, including emergency room visits, those who are classified as a current inpatient, those who are admitted for 1 to 2 days and then discharged, 3 to 4 days, 5 to 6 days, 7 to 14, and over 2 weeks. We see quite a bit of emergency room visits, the year-to-date total being 49 from the Mercy and BJC facilities. So this indicates that someone who is experiencing symptoms are actually experiencing symptoms that are so severe that they would feel the need to visit the ER. We do have 19 residents who are currently in the hospital as an inpatient as well. Next, we would normally review the report for week 32, excluding the long-term care facilities. But as I said earlier today, we're gonna focus a little more on the school-age population data because we are getting closer to the start of the new school year. As of week 32, there has been 176 total lab confirmed and probable cases in the 0 to 19 year age group for Jefferson County. This is a 26% increase in cases for this particular age group over the last 7 days. In figure 1, you will see the number of confirmed and probable cases by week. And I think this is actually very interesting to look at in graph form, because here you can see that back when we started tracking in March, this age group had maybe 1 or 2 cases per week at the most, and now we are seeing around 35 cases per week. In figure 2, we split these up by zip code. So most of the 0 to 19 year age cases we are seeing is within that 63052 area, which is Imperial. They have seen 36 cases so far. Arnold's, which is 63010, has seen 27 cases. And we also have Fenton, 63026, who has seen 22 cases. To dissect the 0 to 19 year age group a little further and give you all an idea of which ages are seeing the highest amount of cases, I have split our school age population into age-based grade levels. These are split amongst the average ages of the children who may be considered pre-kindergarten age, the elementary school age, middle school, high school age. So as you can see on the bottom of the chart there, which ages are classified as each category. The high school age group, which consists of children ages 14 to 19, have seen many more cases than our other 3 age groups. This is important information to know not only for the school systems themselves, but for parents as well. I want to pull up one last chart just to show the daily amount of cases and a rolling average for that high school age group. In figure 7, we see the dotted yellow line is the number of daily cases for those 14 to 19 year olds. And that solid yellow line is the 7-day average. For a while there, as we said earlier, there were very few cases amongst this age group. And right around the end of June is when we really started to see that increase. Please let us know if there are any questions as we continue to review this data together each week. And I hope you all have a safe and healthy rest of your week and weekend. Stay tuned because up next there will be some more information regarding the color guidance system for our county. Thanks, everyone.